So, as Hilary said, this report builds on our on this emerging need that is coming to establish more evidence about our work. What exactly are we doing? What is our impact in the communities that we are working? And to what extent are our claims valid? And our office in MIR, which I will explain a little bit, stands for Middle East, Eastern Europe region, which is a very diverse landscape, is taking this mandate very seriously. And this report actually reflects this intention, because we wanted to look back, and this is actually going to be the first of a series of reports on different sectors, that we're going to try to look back and reflect on our work and to see what are the gaps and how we can improve on those. So the Middle East is a very, the MIR region is a very diverse landscape stretching from South Caucasus, including Azerbaijan, Albania, Bosnia, Pakistan, Afghanistan, all the way down to Lebanon and Middle East, including Syria, an emergency response in Syria. So as you can imagine from the beginning, we're trying here to bring together data from countries which are not really compatible. So already that was a very big challenge. So over the course of the next slides, I'm going to start with an overview of the programs and the beneficiaries that we managed to reach, and then talk a little bit about the different types of programs that we implemented in the area of health, the different types of outputs and outcomes that we have implemented, then present an analysis of the cost that was involved, and finally take you over a sustainability analysis of these efforts that we developed a methodology to look at. And finally conclude with some of the challenges and key messages I want to deliver today. So altogether, over the course of the past 6 years, from 2007 to 2013, MIR has implemented 89 projects in the countries that was previously mentioned. On average, these programs had a duration of approximately 31 months, and there was obviously some variance in that. Some programs were as small as 1 year, others stretched all the way up to 5 years. And this program managed to reach 3.3 direct beneficiaries. Now, for those who are familiar with the language, always there's a big challenge when we're talking about direct, indirect beneficiaries. How do you define those? How do you frame that? In this case, direct beneficiaries refers to people who were directly involved with the program. So people who received training or a capacity building exercise. Of those, 73% were adults and 26% were children. And we only had the gender breakdown for the adults, and that was approximately 44% men and 56% women. Now, the data here reflects only the programs that actually provided information. So we used that, and we also took into account the average country household, and we estimated that in total we had a reach of approximately 14 million indirect beneficiaries. And if we also take into account the missing variables, that would bring us into an estimate of approximately 17.2 total beneficiaries in the countries in MIR. Right. Now, with regards to the different types of programs that we use, some of the language here is World Vision jargon, so please ask me if you have any questions. The first type, as you can see, which refers to access to health, essentially it's a composite group that refers all sorts of programs that are not quite cohesive to each other to be presented as on their own. So we clustered them under this group, but it includes mostly capacity building programs and advocacy interventions. Then the maternal child health, it's actually a global program that World Vision is implementing, targeting young mothers and children, HIV programs, of course. And as you can see, these three account for the vast majority of health programs that World Vision is implementing. When it comes to the allocation of our funding, 56% comes from grants or external sources, as we would say, and 44% comes from sponsorship funds. And Hilary explained a little bit earlier about what are the sponsorship funds in World Vision. Now, we also did an analysis of the outputs and outcomes based on the log frames from these projects. And we have found out that the vast majority of these programs are always evolving around building capacity, training, and raising awareness, which it's an interesting find to look at if you consider that there are other areas to focus as well, especially if you look at advocacy efforts, which are quite small in proportion with the rest. We did an analysis of the outcomes because also to check to what extent the intended outcomes had actually been delivered at the end of the program. So we didn't actually did an impact analysis to see what was the effect of the outcomes on the populations, but we wanted to see to what extent the outcomes that were described in the design of the projects had actually been delivered. And as you can see in the first column there, that reflects the average per country. In some countries, the outcomes have been delivered 100%, such as Lebanon, whereas in some countries, it was quite challenging, and only 47% of those programs were actually delivered. Now, the natural question to that would be, why is that? Why do you have this very large discrepancy? As I mentioned earlier, the region that we're working on is very challenging, and one can imagine the different challenges that exist in operating in countries such as Afghanistan or Pakistan. So that was partially the main reason behind that. The second column is simply methodology. It refers to the included sample because there was a very large number of programs and documents, so we had to follow a stratified randomized sampling, and that tells you the sample that we used for this analysis. And finally, the last column refers to the strategy alignment, where again we followed a similar process, looking at the outputs and outcomes, and then identifying to what exactly strategic objectives could they have been aligned to. And the scale runs from 1 to 4, and as we can see from here, the average for the whole region is 3.6, which is actually very, very high, and tells us that, going back to the discussion on governance, is that we are actually quite focused on how we're implementing our projects. And I'm going to speed this up, because I've just given a sign I have 2 more minutes. This also, again, is a methodological information referring into our sampling strategy. Now, the cost breakdown gives us information about how were the money allocated. And we have 3 categories here that was extracted directly from the program documents. Activity cost refers to costs that are going directly to the beneficiaries, to the community. So that would involve workshops, food distribution activities. Support costs refers to salaries and other costs that are necessary to maintain staff operating capacity and safety. And the shared costs will refer to the overheads. And as you can see here, this is the average for the whole country. The support cost is quite high. But again, I want to highlight that this is the average for the whole region. And again, if we take into account some of the very challenging environments, we can understand why this is significantly high as compared to one would expect. This is the cost per beneficiary, which again is a reflection on the outcomes. And we can see that for total beneficiaries, we had approximately $13.6 per beneficiary across all health projects. And finally, I'm going to take this really fast. This is a sustainability analysis we conducted. As you can see, we have here 6 pillars. This exercise relies heavily on the bond tool that Hilary mentioned earlier, but we included some additional indicators that we felt were really important in order to see what was the long-term possibility for sustainable effects of the programs. Again, the scale runs from 1 to 4, and the way we conducted this exercise obviously was post hoc because we looked at back into 6 years, but we used 4 independent reviewers, And then we cross-reference their results using the Cohen's kappa analysis to see to what extent the results agree to each other. And as you can see here, the result was 0.4, which is definitely acceptable for the amount of work that was done. Now, the average sustainability score is 2.9 out of 4, which is not as high as we would hope to be, but as you can see, across the 6 pillars, some of them are really high, which is institutional development, local ownership, and partnering, which is part of World Vision mandate, and we're really proud of. But some of them are somewhat low, and that is funding provision and resilience, which is something that we have already acknowledged that we need to work furthermore. One more point I want to highlight here is that we also run some correlation analysis to see to what extent these pillars actually link to each other, as one would expect. And what we found was that, indeed, the more effort World Vision was consciously putting into partnering with local communities, the more the chances of finding alternative sources of sponsoring the programs would increase. So that was definitely a very encouraging result and confirms the theory behind the theory of change that we're working on. We also found that the more we invested on institutional development, so building something long-term in the communities, the more that contributed into building mechanisms that would lead to more accountability for our projects. Some of the challenges, I'm not going to go through these, just because Hilary already mentioned this. Obviously, the massive volume of work that we had to do. For this report, we had to review over 700 documents. The quality of the data was challenging, and also the methodology that was used sometimes was actually not very consistent for us to have a logical inference from output all the way to program goal. Just some conclusions I would like to close this presentation is that despite the challenges that we have encountered, World Vision has managed to mobilize a fund of approximately 49 million in the MEA region and touch the lives of 17.6 people, which is a remarkable number if you think about it. Our programs managed to successfully deliver 87% of their intent and outcomes. This is the median value, not the mean, which again, considering the challenging environments that we operate, we found this to be quite extraordinary. And we sort of confirm the mandate behind our work, which is it's very, very important to partner and share the ownership of the programs with the local communities and institutions in terms of building a long-lasting, sustainable effect in the community. Thank you very much.